It is a Wednesday, and it's time for about the last 30 years on the morning show. It's time to talk a little sports medicine, get educated, get into that area, and it's with Dr. Joe Congini from Sports Medicine Center Children's Hospital. Dr. Joe, good morning. What do you have for us today?
Hey, Ray. Hey, we're getting near the end of the year here, and I wanted to sneak two in because people have been bugging me about two issues going on. You know that a lot of times these occur in higher-level athletes, but they relate to us weekend warriors and stuff, too. And I'm going to try to quickly sneak two in. People bug me now at the gym, and they've been really asking me about these two. And the first one is a gentleman by the name of Tiger Woods. And so this may have gotten by some people, but Tiger had another surgery on his back, and we know that he's had kind of a downhill spiral on his back. Since 2014 was his first surgery. He's had 7 surgeries on his back, but in October of this year, 2025, he had a newer surgery, and everybody's asking me about lumbar disc replacement, and they actually have a implant that they will put into the worn-out disc, to the herniated disc, to the injured disc area, and this is something that's been going on for a while, and certain athletes, it would only be certain athletes, so I want to make that very clear. But typically with a collapsed disc like this, you first of all try, of course, all the physical therapy and non-operative stuff, strengthening, PT, time, give it time, injections. Well, Tiger doesn't have much time. He wants to play with his son early in 2026 in a father-son thing. So he was looking at other options. And in the fall, this year he'll be 50 years old. And so from the standpoint of other things he was looking at, one of the things that's out there that are being done, more so in some parts of the country than others, is where they actually replace the disc. And I want to just go over real quickly 4 things that are advantages and risks. Number one, it would give you advantages over the gold standard treatment, which is a fusion surgery of the back, spinal fusion. It actually gives you more motion and mobility for active people, and it restores some of the stability, and that's number one. Number 2, faster recovery. Number 3, less stress perhaps to the other discs around it. And so those are some of the advantages of lumbar disc replacement. And there are several spine specialists doing this surgery. The risks, on the other hand, implant failure, number 1, dislocation of that implanted disc. They say in some of the studies I looked up several studies, that could be anywhere 20, 25, 30%. You have to trust the studies. Number 3, blood clots, infection, like any surgery. It's a newer surgery, but the other is nerve damage. That would be the one that would concern me. Do you end up with a chronic nerve pain? And then finally, number 4, financial. This is not state-of-the-art surgery, so most of it is paid for out of pocket. And I talked to two last night, of our local orthopedists. And in our town, in our area, we have a great orthopedic town. There's not a lot of lumbar disc replacements being done, but it is now an option on the table for certain very active, very in shape people that want to try to get back quickly. So we'll keep an eye on lumbar disc replacement. It first was done in Europe in the 1980s and 90s. It came to the U.S. in 2001 and was approved in 2004. So this is something we'll keep an eye on, and we'll talk about whether lumbar disc replacement becomes something that's done more frequently in our area of Northeast Ohio. From what I gather from some spine specialists, this is not being done that frequently here in Northeast Ohio. Number 2, Ray, everybody's asking me about how could this happen with T.J. Watt. And so I know you're aware of the T.J. Watt situation where he had a lung injury from a very common technique that physical therapists use to get rid of soft tissue injuries and treat soft tissue injuries called dry needling. This is out there. Both of these cases are out there in the literature, many, many articles. So we're not, behind the scenes coming up with anything. In fact, there was a big press conference with J.J. Watt explaining about how his brother had a lung collapse from his dry needling. This is very rare. The literature says 0.1% or less. That's very, very rare. It's a very safe procedure. I get it done with some of the soft tissue back problems in the neck and low back that I have. I feel very safe about it. And I think the two things that again, the way it works, it increases blood flow into these soft tissue injuries, and it actually helps a lot in getting people back and improving soft tissue injuries. It's been a great plus to our physical therapy armamentarium of different treatments that we have out there, of different things we can do, the tools in our toolkit, and many, many people will offer that, and I want to reiterate that it's very safe. The two things are maybe what location they're doing it in might have a little more risk in certain locations that are nearer the lung. And number two is the experience of the PT. Hey, how many have you done? Have you done a lot? Is this something that's very routine for your physical therapist, but very safe, very helpful treatment, and I want to reiterate that. And typically, with this complication, people recover fairly quickly. So the final thing is a lot of people ask me and remember, like me, all they think about with they remember sports stuff is, hey, is this what happened to Tyrod Taylor, the quarterback for San Diego? He actually had a rib injury before a game, and he got an injection to reduce the pain in that rib injury, and he got a collapsed lung. And they had to go to a young quarterback by the name of Justin Herbert, and it was Justin Herbert's first start in 2020. And, of course, you know the rest of the story. He's become one of the best quarterbacks in the NFL. So just to know a little bit about with dry needling and with lumbar disc replacement, I wanted to do a 2-for-1 today as we get closer to the end of the year.
Joe, you know, it's interesting with your opening with number one with the lumbar surgery. You know, I was just talking to a doctor a couple of weeks ago on how far we've come in back surgeries and technology and fixing things that have to do with the back and the spine. Because I remember going back, as obviously you do, because what you do, but you go back to the mid-'70s, early 80s, you had a back issue or a disc issue. You were done for a year or so with a procedure. Now, there's so many different ways to alleviate pain, to take care of the problems. It's been so impressive to me to watch the technology in back procedures.
You are so right, Ray. And for young people out there that still want to get into the field of medicine, there's a lot of people that say, oh, gosh, medicine's got all this pressure and other things in it. Really one of the coolest things that I've learned in a career of 40-plus years is it's always changing. We're always looking for new ways, new techniques. And if you don't keep up literally monthly, yearly, because there are so many new things, and you are absolutely spot on. The things that we're doing now 5 or 10 years ago seem like ancient history in medicine. It's the one thing that's kind of cool for young people. If you like something that's always changing and always challenging you, the field of medicine will do that for you.
No doubt about it. Joe, as always, my friend, thanks for the time you put into the show and the visit with us, and we'll do it again next week.
Hey, Merry Christmas. Thanks, Ray. I appreciate it. Take care.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, joining us live this morning.